Well, good afternoon. Let's try that again. Good afternoon. All right. It's a pleasure for me to be able to welcome you here to Children's National Medical Center. I'm Ned Zeckman, the President and Chief Executive Officer. We here at Children's are honored to once again host the White House and their efforts to educate the country about health care for our children. I'd like to begin this program by thanking and congratulating the President and Mrs. Clinton on their commitment to health and well-being of children. Throughout the Clinton administration, children's issues have been at the forefront of our national agenda. To that end, the President and First Lady have used their positions to help our future generations grow up healthy and strong. At Children's, we share the Clinton vision for children of America. We and they know that children are truly our future. Last year, Children's National Medical Center provided over $30 million in uncompensated care. Therefore, as warriors on the front line of this battle to save our children's lives, we see firsthand the problems families face when children are uninsured. Far too many of our nation's families are denied access to care because of their financial situation. Others are forced to use the emergency room as their primary care provider because they can't afford a doctor for routine care, and other priorities, such as eating and paying the rent, must come first. The result, unfortunately, for many of our families is a pattern of receiving costly health care, which is often too little and too late. We at Children's are working to address this problem. On average, 400 uninsured children come through our emergency room or outpatient clinics each month. Through our outreach and education efforts, we help 70% of these children enroll in Medicaid or other financial assistance programs. We have a family here today that's a shining example of the assistance we provide to those in need. Please recognize Wanda Everett and her sons Amani and Reginald, who are sitting right down here, if they just raise their hand. Thank you. Wanda works for the Arlington County Public Schools as a classroom assistant, helping disabled children. She brought her son to our emergency room just over a year ago because he swallowed a metal staple. At that time, the family did not have health insurance, and our financial assistance staff thought she's able to take and get routine care for her children, including regular medications for her son's asthma. Wanda is one of many who can attest to the fact that the greatest security of all to a parent is knowing that your child has access to health care when needed. The recently enacted National Children's Health Insurance Program will greatly further our efforts to ensure access to all children, regardless of ability to pay. Now I'm pleased to introduce another friend of Children's, Secretary of Health and Human Services, Donna Shillelagh. Although Secretary Shillelagh has a very distinguished career in public service that spans all ages, I'd like today to acknowledge her efforts in helping children. Secretary Shillelagh has been a leader in the Clinton administration's efforts to reform the nation's welfare system. As a leader of the government agency responsible for protecting the health of all Americans and providing essential human services, she's been responsible for many programs and services designed to enhance the health and well-being of children. Ladies and gentlemen, I present to you the Secretary of Health and Human Services, Donna Shillelagh.
Thank you very much. Thank you. Thank you. Thank you, President Zeckman. Thank you for those very warm words. Mr. President, Mrs. Clinton, I can think of no better place to have this event than the National Children's Hospital, a place that clearly gives countless children the gifts of health and of hope. And I can think of no better people to share this with than the many healthcare professionals here, the nurses and doctors and physicians assistants and social workers and all the organizations and foundations that are represented here, the public advocates, the public officials, the businesses, all them represented here to advance our children's interests. The message is clear. When it comes to our children, we are in this together. Today, whenever I visit a daycare center or a school or a children's hospital, I see more than a new generation. I see the children of the millennium. Children are counting on us to give them the nurturing they need to grow and to fulfill their God-given potential in the next century. This administration has fought to improve the health of every child during every stage of development. Before they're born, by ensuring women have greater access to prenatal care. Right after birth, by working to ensure that mothers and children can stay in the hospital longer to recuperate. The toddler years, by ensuring more children receive their immunization vaccines. The wonder years, by prohibiting tobacco companies from advertising to kids and eliminating easy access to tobacco products. No child can have a healthy start in life without access to quality health insurance. Today, 10 million children have no coverage, and that's why the President has launched the Children's Health Insurance Program, CHIP. It provides $24 billion initially to help states cover children without coverage, either by expanding their current Medicaid programs or creating new health insurance plans. It's a true federal-state partnership. The states design their own plans under this program. They submit them to my department for approval and are then eligible for federal funds. All of these measures are helping to give the children of the millennium a healthy foundation on which to build their hopes and their dreams. And no one has done more to help build this foundation for this generation of American children than our First Lady. Mr. President, just over 5 years ago, when you nominated me as Secretary of Health and Human Services, I talked about you and I thanked you, but I also talked about how Mrs. Clinton and I had spent most of our adult lives, often together, to make certain that no child is left behind. To this day, I remain proud to have had the opportunity to continue to work with our First Lady. Today's achievement is another example of her commitment to leave no child behind. It is now my pleasure to introduce my friend and our First Lady, Hillary Rodham Clinton.
Thank you. Thank you. Thank you very much. Thank you. Thank you. Thank you all. Thank you very much. I am so pleased to be back here at Children's Hospital. And I was remarking to Ned that this is where I bring socks every Christmas, and it doesn't look the same at all. And I have many warm memories of my visits here and such very favorable impressions of the work that is done by the entire hospital staff. And I'm delighted that we could have some of the children who are patients here with us today, because this is really about them. As Ned said, this hospital provided $30 million in uncompensated care last year. And it takes a lot of effort to be able to afford to do that. But thank goodness that this hospital and hospitals like it throughout our country are here for children who do not have public or private insurance. That $30 million of uncompensated care went to children who are the children of working parents, who work and live not only in the district, but also in Maryland and Virginia and sometimes Pennsylvania and other places far from here. So we are gathered here today to make announcements about what needs to be done to ensure that the children of our country will be taken care of because of the passage of the very important legislation that the Secretary just referred to. I especially want to thank Secretary Shillelagh, Congresswoman Norton, and I believe Congresswoman DeJette are here as well, Mayor Berry, members of the City Council, Charlene Drew Jarvis, Sandy Allen, and Hilda Mason. I want to thank the entire staff of Children's National Medical Center, and as I look at this audience, many of you who are partners, colleagues, and allies with this center because of the work you do on behalf of children here and throughout our country. You'll hear in a minute from Linda Haberman, who is here with her husband and her children. And I hope that all of us, as we listen to Linda, will think about the many Lindas, the many mothers and fathers around our country who worry about whether or not their child will get not only the acute care that comes from showing up at the emergency room, but the chronic care for diseases like asthma or diabetes. Last August, when the Congress passed in a bipartisan fashion the President's proposal, we saw the largest expansion of health care in 30 years. We made a commitment on that day as a nation, not only of $24 billion, but of a federal-state partnership to ensure millions of children. Now, when the bill was enacted, that was the first step, but there, we knew, was a lot of work to be done. As I said at the time, fulfilling its promise would depend upon what we did in the months and years ahead. We knew that finding children scattered across the country who were not insured would not be an easy task. 3 million of our children are eligible for Medicaid, but they don't sign up. They don't become enrolled. Unless they come here to the hospital where someone can help them with financial assistance, they may not even know they are eligible for Medicaid. Some children lose coverage when their parents lose their jobs. And the majority of the uninsured 10 million children have parents who are working hard every day, but they make too much money to qualify for Medicaid, but not enough to afford private insurance. So what we want to do with the announcements today is to make clear that these resources, which our entire nation has supported through the enactment of this legislation — I saw Congresswoman DeJette just come in, thank you for being here — will actually get to the people to whom it should. That means that states will have to do their part, businesses and foundations as well, doctors and nurses and hospital personnel, teachers and others who interact with families and children. The National Governors Association is issuing a best practices report about what state efforts are really working. There isn't anything more important to any parent than making sure that your child stays or gets healthy. I can remember very well, as I'm sure every parent here can, how even the slightest sign of illness with our daughter sent both Bill and me into mild panic. And we had to be sure that we could take care of her, and we were fortunate enough to be able to do so. But our next speaker really represents the parents of our country. She's the expert on the subject of why we need to make sure that this program is implemented so that every child gets the health care that child deserves to have. As her family has learned from personal experience, these new efforts that the President will announce today will help parents to not only take care of their children, but get the peace of mind that many of us in this foyer take for granted. It is my great honor to introduce Linda Haberman from Williamsburg, West Virginia.
Thank you, Mrs. Clinton, for that kind introduction. I also would like to thank you, the President and Secretary Shillelagh, for your work to help children across the country. I am here today with my husband, Tom, and our 3 children, Raymond, Michael, and Andrew. We live in Williamsburg, Virginia, where my husband has a good job working as a mechanic for a construction company. Unfortunately, our family does not earn enough to be able to afford private health care. 3 years ago, when we moved from Newport News, Virginia, my second son, Michael, was constantly sick with ear infections. We were very worried because we didn't have health insurance. We took him to doctors as much as we could, but we simply could not afford as much as needed. We always worried that his ear infections would lead to something much more serious. Mr. President and Mrs. Clinton, it was a horrible feeling not to be able to provide our son with the health care he needed, and to know that any childhood accident or illness could cause our family financial hardship. Luckily, we were relieved when a Salvation Army worker told us our sons might be eligible for the Medicaid program and referred us to the Child Health Investment Program. This program helps parents learn whether their kids are eligible for Medicaid and shows them how to enroll. Within a week, my son Michael had Medicaid. If this program had not told us about Medicaid, we never would have known he was eligible for health insurance. Medicaid has also helped my 18-month-old son, Andrew, who, like Michael, had multiple ear infections. Until recently, unlike most children his age, Andrew did not talk at all. Our doctor told us that this was likely because he has lost 20% of his hearing because of ear infections. Just 2 weeks ago, Andrew had surgery to insert tubes in his ears. I am proud to report that a week ago, Andrew said his first 4 words: Mama, Dada, Bubble, and Shoe. I don't think we would have heard those words for quite some time if we had not been able to get health insurance that covered the care Andrew needed. Mr. President, Medicaid has helped give Michael and Andrew a regular childhood and will help them grow up healthy and strong. That is why I am so pleased to learn what you are doing today to help educate families about health insurance. Our family was very fortunate that we had a program to tell us about Medicaid. But I imagine there are many families out there who may never know that their children can get covered. I am also thankful to learn that states are taking new steps to cover even more uninsured children through the new Children's Health Program you signed into law last year. My oldest son, Raymond, is still uninsured because he is too old for Medicaid in our state. I am hopeful that this new program will cover Raymond and give our family and many other families in Virginia peace of mind once and for all. And now I am honored to introduce the President of the United States, Bill Clinton.
Thank you very much. Thank you, Linda. Ned Zeckman, thank you. Thank you, Secretary Shillelagh, for your wonderful work, and I thank the First Lady for what is now a more than 25-year crusade to bring quality health care to children. We're delighted to be joined by Mayor Berry and members of the D.C. City Council, Congresswoman Eleanor Holmes Norton, and Congresswoman Diana DeJette from Colorado, and many, many child advocates in this audience who have been working on these issues a long, long time. Last month, in the State of the Union address, I asked the American people to work together to strengthen our nation for a new century, and especially to build the right kind of future for all our children with world-class education and quality, affordable health care. Let me begin by thanking the men and women who work in this hospital for their efforts to restore our most fragile children to health, to give many of them second chances at life. This is a place where medicine shines and miracles happen every day. But it should not take a miracle to ensure that children like Linda's children have the care and insurance they need to stay healthy and to be treated when they're sick. I still have a hard time believing that this country with the finest health care system in the world cannot figure out how to give affordable, quality health insurance coverage to every single child in America. Step by step, we are working hard to make sure all Americans get the health care they deserve. 2 years ago, we passed a law, and I signed a law to make sure every American could keep his or her insurance when they change jobs or when someone in the family is ill. Last year, in the historic balanced budget agreement, we extended the life of the Medicare Trust Fund for more than a decade. We also made this unprecedented $24 billion commitment to provide health care to up to 5 million more children. And I want to say more about that, obviously. In addition to implementing the provisions of the balanced budget law to cover children, this year we're also going to attempt to pass a health care consumer bill of rights, which is all the more important since 160 million Americans are now in managed care plans. We want to extend Medicare to Americans aged 55 to 65 who've lost their health insurance who can buy into the program. And of course, we want to protect all our children from the dangers of tobacco, and we're hoping and praying for a comprehensive resolution of that issue. But let's go back to the question of covering children. Congress appropriated the money, $24 billion over 5 years, with the goal of insuring 5 million of the 10 million children who don't today have health insurance. Now, 3 million, as the First Lady said, 3 million of the 10 million kids who don't have health insurance are eligible for the Medicaid program today. If we could get 100% of those children into the Medicaid program, we could actually insure more than 5 million children for the $24 billion. But if we don't get any new children into the Medicaid program, or very few, then we're going to have a very hard time meeting that 5 million goal. So this issue of not only helping the children and their families, but also the hospitals and the providers who have to be reimbursed for the care they give, with expanding the Medicare program to the children who are eligible, is profoundly important if we are to reach what I know is the goal of every person in this audience, which is to provide affordable health insurance coverage to our children. Now, this Children's Health Initiative that was part of the balanced budget agreement is part of the kind of the vision of government that has driven our administration from its first days. I always believed that we had to get rid of the deficit and balance the budget, because otherwise the economy wouldn't work right. We couldn't get interest rates down. We couldn't have new investment for businesses to create new jobs. People couldn't afford to buy homes. We'd have all kinds of problems. But I also always believed that we had to do it in a way that left more money to invest in our future, particularly in education and health care and the environment and the things that will shape the quality of life. So that's what we're trying to do. But I want to say again, just the fact that this money has been appropriated is not enough. We cannot let the appropriation of money just sit there. We can't just have laws on paper that say we're going to cover 5 million more people. Those of you who work in these programs understand that this is a complex and challenging task. Most of these children are like Linda's children. Most of these kids that we're trying to cover are the children of working people who are working hard and doing their very best every day and paying their taxes and simply cannot afford a traditional health insurance plan. One of the ways that we have to deal with this is to expand Medicaid coverage to the 3 million who are already eligible under the law. One of the most shocking things to people who don't have this problem is to find out that huge numbers of these kids are prevented from getting medical care simply because their parents don't know they're eligible. Therefore, all of us have an obligation to see to it that every child who can take advantage of this historic investment in health care does so, and does it now, beginning with the Medicare program. The federal government must do its part. States and businesses and individuals must step up to the plate. And our message to parents and to teachers, to preachers and to coaches must be, what you do not know can hurt your children. You have to find out if your child is eligible for the Medicaid program. Today, I am launching an all-out effort to let every family know about health insurance, whether it's Medicaid or another state program that is currently or soon will be available, because there are now new children's health programs coming online under the program passed in the balanced budget bill. In a few moments, I will sign an executive memorandum directing the 8 federal agencies who run our children's program, such as WIC and food stamps, to cooperate in a comprehensive effort to make sure that every family gets the information they need to enroll their children, whether from an agency employee or from pamphlets, toll-free numbers, or simplified application forms. And I call on Congress to pass the new funds I'm requesting in this balanced budget to help states publicize their new child health programs and their child centers and enroll children in Medicaid automatically, even as they wait for final approvals of their applications. Next, and most important, every state must take responsibility for ensuring that every eligible child within its borders gets insured. Medicaid is one of the best ways to expand health insurance to more children, and it is a state-run program. I'm pleased to announce that Colorado and South Carolina will join Alabama as the first states to expand insurance coverage to more uninsured children under the bill we passed last year. But you should know that over 40 more states are well on their way to expanding their own insurance programs. I applaud the governors for their commitment and their innovative efforts to enroll more children. And I thank Ray Shapak from the Governors Association for being here today. We can't rest until every state has a program and a commitment to implement it. Finally, the private sector has to help us get the job done. Many businesses and foundations have already joined in. Bell Atlantic will provide the leadership to establish a new 800 number that will direct families to state agencies in charge of Medicaid. Safeway's agreed to put the 800 number on their shopping bags. The National Association of Chain Drugstores and the National Community Pharmacists Association will help us get the words out whenever parents pick up prescriptions. Pampers has agreed to include a letter in parent education packages that go to millions of new mothers in the hospital. I thank all of them for being exemplary corporate citizens. And I'm pleased to announce that the Robert Wood Johnson Foundation and the Kaiser Family Foundation have committed more than $23 million to finding better ways to expand coverage and outreach efforts. America's Promise, the outgrowth of the President's Summit on Service, made a healthy future for all children one of its 5 goals. And along with the American Academy of Pediatrics, the American Hospital Association, the National Association of Education, all have launched their own efforts to target and enroll uninsured children, and I thank them. This is an extraordinary partnership to make sure that every child gets the health coverage he or she needs to have a fair and healthy shot at life. but it is only the first step. We need every parent, every grandparent, doctor, nurse, healthcare provider, teacher, business leader, foundation, every community all across America to work until they find the ways to reach all our children who can be covered by Medicaid or by the new Children's Health Insurance Program. Like all parents, Hillary and I know from experience that nothing can weigh more heavily on your mind than the health of your child. The slightest cough, the most minor accident, can cause enormous worry. I can barely imagine what it would be like to also have to worry about finding the money to pay for your children's health care in the first place. Too many parents live with these worries every day. Millions of our fellow Americans. People who are dedicated citizens, people who get up every day and go to work, people who pay the taxes they owe to the government, people who do everything that is expected of them and still have to worry about the health care of their children for lack of insurance coverage. This is wrong. If we really want to make America strong for the 21st century, we will correct it. We have the tools. It is now up to us to use them. Thank you very much. God bless you all. Thank you all.